certain data and web pages with the health information related to gender and equity have been removed from the Centers for Disease Control websites. Now, the changes are to comply with President Trump's executive order to eliminate federal DEI programs, and federal staffers have been warned of severe consequences if they do not comply with the orders. With me now is Dr. Jennifer Nuzzo. She's a professor of epidemiology at Brown University and the director of the Pandemic Center at Brown University's School of Public Health. Dr. Nuzzo, good morning to you. And let me start with some of these web pages. A page entitled Facts About LGBT Youth Suicide. Another page about creating safer schools for LGBT plus youth. Both of those are gone. You can eliminate the pages, you can't eliminate the people. What are the consequences of what's implied by the elimination of these pages on these public health websites?
Yeah, so these have been deeply disturbing developments. What we're seeing is sort of widespread tampering and dismantling of really critical public health data. This is happening at the direction of politicos, not scientists. There's a reason why these data were collected. They're critically important for health agencies, particularly in our communities, to know how to protect us, to know where in our communities needs are greatest and how to direct the very limited resources we have to protect people. So taking away the data just makes that job harder. There's never been this level of just sort of dismantling and tampering with data that we've seen. And it is deeply concerning, and it's only going to sow really distrust in the federal government. And I just don't think that there's any, I just don't think that that's in anyone's benefit.
You phrase it as taking away the data, and this is what I'm interested in. Is this, from the public health community, an assumption that it's short-lived? I mean, at some point there will be an administration that believes that transgender people exist and may be willing to make that information public again. The question is, do you believe at that point it will be retrievable? Is there fear that the data will just be gone?
Yeah, so first of all, there's a lot that's unknown, and a lot of these actions, I think, are happening in part because the directions that have come out of really the White House have been so broad that they're just very hard to interpret. So what you're seeing is really sort of widespread changes being made, in part because of lack of guidance. So that's just one of the problems. The other problem is that, there are actual changes being made to the data. So for instance, changes like removing what had been a category of gender that gives sort of multiple descriptions of who is being affected by certain diseases, and trying to reduce that to the binary category of sex, male or female. Now, for people who aren't epidemiologists, that might not seem like a big deal, but there is a reason why public health professionals have been wanting those more granular data, because they help us better understand what is happening in our communities and understand who we have to reach out to in order to make our communities safer. So that kind of change that's happening is also really important. Now, the federal data that have been taken down, and just to say that you named a few sites, but we have seen sort of widespread data disruptions since these orders have been given. And I think there's a lot of questions about when it's going to end. I will say that you can't really keep data behind a lock and key. And, in those amount of days, there have been groups all across the country that are trying to that have been downloading the data set. So what has been collected so far does exist, but there are questions about whether we will continue to collect the data we need and share that information with our communities so that our communities know how best to protect themselves.
Yeah. Weekly reports, public statements from FDA, NIH, CDC, embargoed unless approved by an appointee, a senior level Trump administration delegate. What is the impact? Take it for a second out of your profession and put it into my life. What's the impact of not getting those reports?
So first of all, information and communication is one of the most important public health tools that we have. And it's not just the reports that are not coming out. It's also the fact that our health agencies have been unable to get on calls with our state and local health officials. They have been unable to share really important information about what's happening not only in the United States, but the rest of the world, the things that could be coming to our communities to affect us. Why is that important? Well, right now we have multiple ongoing, very concerning, and in some cases deadly outbreaks happening not just here in the United States, but in the rest of the world. So there's been avian influenza, which is a really concerning situation that we need minute-to-minute information on. There's also in the United States one of the largest tuberculosis outbreaks happening. It's happening in the American heartland. We need to know what's going on with that. Across the pond, as it were, there are multiple viral hemorrhagic fever virus outbreaks, things like Ebola and Marburg virus, deadly viruses. We know that infectious diseases don't stay put and they don't take a break.
Yeah.
And so we need to get up to the minute information about what's happening with those outbreaks so that we know what risk it poses to American communities and what communities need to do to protect themselves.
Yeah.
And when CDC can't even talk to our health officials, they cannot fulfill their statutory obligation to protect America's health.
You know, it's interesting. I read a piece in the New York Times this morning about how the stop work on foreign aid has stopped some of the services around the world to try to stop the spread of some of those diseases as well. Dr. Jennifer Nuzzo, thank you so much for your time and expertise.